We've got some muscles up our sleeve. This is a video about the muscles of the upper limb and their innervation. The nerves that innervate the muscles of the arm stem from the brachial plexus. The 5 roots of the plexus are from C5 to T1. These then form the superior, middle and inferior trunks. Together these split to form the anterior and posterior divisions. The posterior division forms the posterior cord, which the axillary nerve comes off. The posterior cord continues on to form the radial nerve. The next 3 nerves form an M shape, combining musculocutaneous, median and ulnar nerves. These 3 nerves stem from the medial and lateral cords. To visualize the location of these nerves on the body, we have drawn it onto Annabelle's arm. The axillary nerve arises from the posterior cord, passing under the axilla and onto the posterior arm. The radial nerve, also arising from the posterior cord, follows the axillary nerve. It extends posteriorly along the length of the arm before reaching the lateral epicondyle of the humerus, where it crosses back to the lateral aspect of the anterior forearm. The musculocutaneous nerve arises from the lateral cord and travels along the anterior arm. Here it is shown terminating at the elbow, however it does continue down the forearm as the lateral cutaneous nerve. Unlike the other nerves, it innervates the skin of the forearm, not the muscles. The median nerve arises from the lateral and medial cords. It extends down the medial side of the anterior arm. It crosses the elbow joint and extends down the anterior forearm along the midline. As you can see, this forms the middle part of the M shape in the brachial plexus. The ulnar nerve arises from the medial cord. It originates on the anterior arm but moves around to the posterior side, passing the medial epicondyle of the humerus. It extends medially down the anterior forearm. The first muscle we're going to look at is the deltoid. It is innervated by the axillary nerve. Its primary movement is abduction of the arm. The posterior muscles of the arm are innervated by the radial nerve. These muscles are the triceps brachii, the long head, medial head, and lateral head. All 3 are involved in extension of the elbow joint. The first posterior forearm muscle is the extensor carpi radialis longus, which originates at the lateral supracondylar ridge of the humerus. The next 2 are the extensor carpi radialis brevis and the extensor carpi ulnaris, which both originate at the lateral epicondyle. Unlike the extensor carpi radialis muscles, which travel laterally down the forearm, ulnaris travels medially down the posterior forearm. The tendons of these 3 muscles extend to the 2nd, 3rd, and 5th metacarpal bones of the posterior hand respectively. All 3 of these muscles cross the wrist joint and therefore allow extension of the wrist. The next muscle is the extensor digitorum. The tendons of this muscle travel to the distal phalanx of the 2nd to 5th digits. This is important as it allows complete extension of the whole finger. Notice that he can extend his fingers completely from a clenched fist. Another muscle in the posterior forearm is the extensor digiti minimi. Its tendon travels to the distal phalanx of the 5th digit, allowing extension of the pinky. Movement of the thumb is controlled by 3 muscles. The first 2 are the extensor pollicis longus and brevis. The longus tendon travels to the distal phalanx and the brevis tendon travels to the proximal phalanx of the thumb. Together they allow extension of the thumb from a flexed position back to the anatomical position. The third muscle is the abductor pollicis longus. The tendon of this muscle goes to the first metacarpal and allows abduction of the thumb. The muscles of the anterior arm are innervated by the musculocutaneous nerve. A deep muscle of the anterior arm is the coracobrachialis. It is attached to the coracoid process and humerus, allowing for flexion and adduction of the glenohumeral joint. The brachialis is another deep muscle on the anterior arm. It crosses the elbow joint, allowing for flexion of the forearm. The biceps brachii consists of 2 muscles, the long head and short head. Their tendons are located deep relative to the deltoid. The short head tendon originates at the coracoid process and the long head tendon originates at the supraglenoid tubercle of the scapula. Both the long and short head cross the elbow joint, so together they flex the forearm. The long head is also involved in supination of the forearm. Majority of the muscles in the anterior forearm are innervated by the median nerve. The deepest muscle of the anterior forearm is pronator quadratus. This muscle pronates the forearm. Flexor digitorum profundus is another deep muscle. Unlike the other muscles of the anterior forearm, this muscle is not exclusively innervated by the median nerve, as the medial 2/3 is innervated by the ulnar nerve. Its tendons extend to the distal phalanx of the 2nd to 5th digits, allowing flexion of the fingers, including the fingertips. Flexor pollicis longus is involved in movement of the thumb. Its tendons extend to the distal phalanx of the thumb, allowing flexion of the entire thumb. Superficial to the flexor digitorum profundus is the flexor digitorum superficialis. Unlike the deeper muscle, its tendons only extend to the middle phalanx of the 2nd to 5th digits. This allows flexion of the fingers without flexing the fingertips. The muscles in the most superficial layer of the anterior forearm are arranged in order of PF. The first muscle is pronator teres, which is involved in pronation of the forearm. The second muscle is flexor carpi radialis. Its tendon crosses the wrist joint and inserts into the 2nd and 3rd metacarpal bones, thereby allowing for flexion of the wrist. The third muscle is palmaris longus. This is a vestigial muscle which attaches to the deep fascia of the palm of the hand. It serves no current function and is not present in everyone. To check if you have it, flex your wrist while touching your thumb and pinky together. The fourth muscle is the flexor carpi ulnaris. This muscle is innervated by the ulnar nerve. Its tendon crosses the wrist joint, inserting into the pisiform, allowing flexion of the wrist. And with that, we have looked at all the muscles of the upper limb. We all have some muscles up our sleeves, and maybe you can take them into the exam with you too.